The federal government on Monday flagged off the second phase of the COVID-19 vaccination exercise in Nigeria. According to the Executive Director, NPHCDA, Faiza Shuaibu, over 4 million doses of Moderna vaccines were donated by the United States government, and 177,600 doses of Johnson & Johnson vaccine received in the country last Thursday will be rolled out during the second phase vaccination of Nigerians against the COVID-19 virus. He, however, noted that the agency has trained over 40,000 state-level personnel to capacitate them for the rollout. Our correspondent, Benedict Uku, has more.
In its efforts to vaccinate Nigerians against the COVID-19 virus, the federal government on Monday flagged off the second phase of vaccination exercise in Nigeria. Recall that the country had earlier received over 4 million doses of Moderna vaccines and 177,600 doses of Johnson & Johnson vaccine. Speaking during the flag-off, the Executive Director NPHCDA, Faisal Shuaib, said the Johnson vaccine will be focused on those who live in the hard-to-reach areas and the elderly. He also noted that the country will also be receiving 698,880 doses of the AstraZeneca vaccine today, Monday, donated from the UK government through the COVAX facility.
Because the Johnson & Johnson vaccine is a one-dose effective vaccine, the 177,600 doses will be focused on those who live in hard-to-reach areas. That is to say, those that live in riverine areas, desert areas, mountainous areas, security-compromised areas. This is because they are the people who may find it difficult to leave their homes to the health facility for the second dose vaccination. We will also be receiving today 698,880 doses of the AstraZeneca vaccine, a donation from the UK government through the COVAX facility. These doses will be targeted at those that are due for their second dose of the AstraZeneca vaccine. In the next couple of weeks, we'll be expecting up to 3.9 million additional doses of the AstraZeneca vaccine to complement what we already have and to ensure that we cover not only those who will be taking their second doses of the AstraZeneca vaccine, but for those who would prefer to take their first doses as well.
The Minister of Health, Osage Ehanire, and other top dignitaries also admonished Nigerians to partake in the second phase vaccination exercise.
To let all Nigerians know that these vaccines are safe and they have been tried and tested. We have not lost anybody to it in Nigeria. There are people who have had small complaints, but none of them has been fatal. And then to urge everybody to participate, we are looking for at least 70%. As has already been indicated, Nigeria is also working on being a production site for vaccines.
I therefore urge all stakeholders to mobilize their community members aged 18 years and above, especially the elderly, to get vaccinated against COVID-19 to stop the transmission of the virus, as vaccines is pivotal to our efforts at containing the spread of COVID-19. As the second phase of vaccination commences today, I believe our governors and all those in leadership positions would intensify mobilization efforts and continue to facilitate the vaccination of eligible persons in the state and the local governments to ensure all allocated vaccines for the second phase are fully utilized, just as we did during the first phase when we had 100% utilization of available vaccines.
The executive director, however, assured Nigerians that all brands of COVID-19 vaccine used in Nigeria are safe and effective, especially against the Delta variant.